Today's show is brought to you by Seasons Car Wash. Today is a car wash kind of day. Seasons Car Wash on Parnell Road. The drive-thru is open till 6 p.m. today. Family-owned business since 1996, thanks to Seasons Car Wash. Next, from the Jackson County Health Department, Director of Personal and Preventative Services, RN Matthew Budd. Hi, Matthew.
Hey, Bart. Glad to be back.
Yeah, welcome back. And 2-year anniversary of the start of the pandemic.
Yeah, and what a journey.
Yeah.
We've really had a lot of highs and lows. And as you and I were just talking about, things right now are looking pretty good. We've just moved to a low-risk transmission in our county as kind of new guidance set forth by the CDC a couple weeks ago. But what that means is that cases are low, hospitalizations are low, and we're kind of in a monitoring period.
It started as an epidemic, switched to a pandemic as it affected the whole world, and the hope is that it transitions to an endemic. That's the hope of health officials, isn't it?
Yeah, absolutely. Much like flu, where there's seasonal trends, and we'll watch it for outbreaks and work with individuals and facilities and groups that might be affected. And the hope is that sometime soon we'll be able to move into that stage with COVID too. And I don't think it'll leave us, but maybe some targeted approaches, working with those groups that have an outbreak, a couple cases, and of course, when cases rise in the community, we'll probably put out some guidance and put those masks back on in areas when it is high risk and encourage, a little bit more distancing. But hopefully, we've seen the worst of it. But it's really hard to say at this point. So
yeah. And of course, vaccinations are still available.
Yeah, people are still coming in every day. We're open for vaccines. Our numbers are much lower than they were, and what we do see is when cases rise, people getting vaccines and their boosters rise, and when things are slowing down, they know we're available.
One of the things I think we're concerned about as a society is that our other health factors suffered during the pandemic. Nutrition, for one. There was, people called it the poundemic. People gained weight because, well, their gyms were closed or they were just home all the time. Or
right.
We were more concerned about staying alive than we were about just our everyday maintenance of health.
Right, and it's a real challenge, especially when your activities and what you do for fitness or for nutrition and for your lifestyle, when those habits get altered. So it is the National Nutrition Month, and this month's theme, or this year's theme, is World of Flavors. So we're highlighting diversity in food. And I think one thing that you can really do is make sure you have a diverse plate. So fruits, vegetables, and trying to have a well-balanced meal. And what they're really stating is that people can make better changes bite by bite. So you don't have to alter your plate and eat something different than what you're used to, but add a vegetable, add a little bit of something new each time you set up that plate for dinner or lunch.
And all this month, it is National Nutrition Month, World of Flavors. So try something new.
Yeah, absolutely.
Mix it up.
Yeah, one of my suggested strategies is if every time you go to the grocery store, try to buy a fruit or a vegetable you don't normally buy, and try to do something fun with it, or look up what you can do with it, because it'll expand your palate a little bit. Maybe you'll find something you like, and it's always good to eat more fruits and vegetables.
Yeah, it's easy to get in a rut.
It is, right. It's okay. I love my weekly meals that I always do, but try to find ways to add a little bit more variety.
Now, who cooks in your family?
It's mostly me. I don't know, my wife might watch this later and argue with me, but it's mostly me.
Yeah.
But we do try to change things up pretty often when we can.
It's hard. You get into a rut where you buy the same stuff every week, and you make, every week it's meatloaf and tuna sandwiches. I mean, the repeats are constant.
Oh, and it's a challenge too, when you look at that fast, easy thing you can grab when you're going off to work and thinking about breakfast, it's easy to grab that processed good, that bagel. But thinking about yogurt and some other things that are easy to grab in the morning or for dinner, thinking about different things you can do for different vegetables you can make. It's a challenge, but it's a good challenge to try to overcome.
Well, we've also got the challenge of rising costs in some of the supermarket items, things that we're buying. So you also have to look at the pricing.
Oh, right, absolutely. You know, when you look at the sales, a lot of the time the processed foods can be cheaper than those vegetables. So, or at least a lot more work needs to go into those vegetables for that meal.
All right, so I'm going to give you an assignment. You are going to try something new that you've never tried before. And next time you're here, we want a full report.
That sounds great.
I'll do the same.
Okay, good.
All right,
Yeah, excellent. I'll hold you to it.
good. Let's see, what other health issues? I think the last time you were here, we were talking about the increase in some other communicable diseases. What about sexually transmitted diseases? Are they up, down, steady?
They're up.
Up?
Actually, yeah, across the state. So we're working on preventing of those illnesses. Of course, there's a lot of tracking, a lot of outreach, and trying to make sure that those people who are most affected have the information, have screening available, and the resources they need to take care of the issues they might have.
Do we know why they're up?
I would say there's probably a lot of causes. Like you said earlier, during the pandemic, people stopped seeking care for a lot of things. So people they stopped seeing their health providers quite as much. And so those opportunities to screen and to provide education, for that in-person education in schools, because a lot of the time at the health department, of course, we see younger people. We miss those opportunities to talk about healthy lifestyles and making improvements in our own lives. So hopefully over the next couple of years, and I think we'll have to reclaim that ground we've tried to do better with in the last decade or two, but hopefully in the next couple of years we'll be able to get that messaging out a little better.
And the psychology of sexually transmitted disease, people will they'll hope it goes away. They'll deny.
Oh, right. Yeah, the little bit of denial. No, that was kind of weird, but it's probably fine. And the truth is too, a lot of the time, a lot of illnesses, a lot of those infections, there's no signs or symptoms. So they can go pass from one person to another without that first person knowing. So a lot of our work, actually, in the health department for sexually transmitted disease is that case investigation, figuring out somebody's positive, and then you do contact tracing.
Oh my
You help
gosh.
identify partners, so that way you can treat them and give them calls, and anonymously as best you can, of course.
Oh, that must be challenging to be sexually transmitted disease contact tracing investigator.
Right. Well, and that's why when you look at the health departments that do their sexual health services, which we do in Michigan, of course, that are health departments, that's why we were set up pretty well to start with COVID-19 case investigations. We had those skill sets already developed.
So you know how to ask those questions sensitively.
Yes.
Yes. So we've got World TB Day coming up during March. So National Nutrition Month in March and World TB Day. And is this a disease that we thought was eradicated, or had it ever not gone away?
We've been pretty fortunate in the U.S. and really U.S. and Canada. Our tuberculosis rate is very low. When you look at the world, though, tuberculosis until COVID was the leading cause of infectious disease death. So over 1 million, close to, and so the numbers are a couple years old, but 1.5 million deaths associated with tuberculosis each year globally. And I actually did some investigating too, coming on to World TB Day, wanted to be very knowledgeable, looking at it. So tuberculosis killed in Europe between the 1600s and 1800s, 25% of all deaths in Europe were associated with tuberculosis consumption.
Oh my.
It's still a very fatal disease, and it's taken us quite a bit of time to really figure out what to do about it. You think back to the 1930s, 40s, 50s, when you had those iron lungs and people going to those treatment centers. That was for tuberculosis, a very serious respiratory disease.
So like COVID, it's transmitted essentially the same way, and it is highly communicable.
Right, yeah, just like COVID, it's airborne. Thinking back to my earlier nursing days, we had the airborne precaution units. There's negative air pressure in those units, so people with active respiratory disease can go in those hospital rooms, pumps that air out so you're safer as a healthcare worker. And really, a lot of tuberculosis screening in the U.S. comes through healthcare facilities. We look at, sometimes those patients, but really those staff members who are at high risk for coming into contact with tuberculosis. A lot of the time, healthcare workers get screened annually, and there's a tuberculin test, goes right under the skin, and if there's a reaction in 2 days, we know that they've been exposed to the bacteria, And so we actually, when we're looking for tuberculosis, we look for latent or not quite yet active tuberculosis, or we look for active as somebody actively sick with it. In our community, we'll usually have a couple active cases in Jackson County at any one time. But latent will usually have maybe a dozen or so, just people with the bacteria, but they're not sick, they're not contagious. But one of the issues and one of the challenges is you have to do pretty good screening to find it. And then also the treatment is, it's not a great treatment. So it's 3 months of treatments, so pills orally once a week for latent TB, but for people with active disease, it's 6 months of treatments, daily pills, and it's a big cocktail of 4 pills per day.
Is this something that we get a vaccine for? Is it part of the battery of vaccines that we get when we're a kid?
It's not. There are some vaccines available in countries where tuberculosis is still a major respiratory illness, but here in the U.S. it's not that common, so we don't actually have it in our normal childhood immunizations.
How do people get it? I'm shocked that there's a couple to 12 people in the county that have it.
Right. Well, what we do is we find a lot of, there's a lot of at-risk settings. So a lot of the time they're associated with congregate care, health care, homeless shelters. And looking at the U.S., so what we do see is that a lot of the time tuberculosis spreads in those groups, so spreads in groups where people don't really have the means for adequate ventilation and space. So a lot of times we see it in poverty, and we do see it a lot in migrant groups that have to move around the U.S. quite a bit too. Knowing that, Asia and Africa have some of the higher TB caseloads, so we do see, especially in the U.S., a higher incidence of tuberculosis and non-white groups. So a lot of the time we do have to do some searching and tracing. And here, of course, when we do look at our at-risk facilities, congregate care, so our older adult living facilities and our homeless shelter, we do work with people who are really vulnerable and who haven't had any healthcare attention, and maybe they've had a chronic cough for some time and don't really know why. So that's when we have to start working with them, and then to go through that contact tracing piece again. Who were you around and who could potentially be exposed?
So there's racial and economic and ethnic disparities for every disease, essentially.
There are, yeah.
So first year of the pandemic, no flu. We were flu-free. So how about year 2? Did we see the cases stay down?
We're doing better right now. And so I will say we usually do see cases rise again in March and April, so I'm still hopeful that we won't see a spike come, but looking at this year, another pretty good year for us in regards to staying safe from the flu. We have had some cases. I just talked to a superintendent was saying that they've had some confirmed influenza A, but it's been very minor, very few cases. Which is good too, because I did hear that the vaccine this year didn't quite get the right strains. Which happens.
Yeah.
So, it still offers some protection. I do recommend you get it, because even if it's not protected against those right strains, it still helps that immune system recognize, oh, this is influenza. Not exactly who I prepared for, but pretty close. So it's still going to help that immune system.
Yeah, and so we're still in the flu season because of the weather?
Right, March, April. So after April, generally cases taper off for the summer.
All right. Thanks for all the updates.
Of course. Hey, thanks for having me on.
Good to see you. And don't forget your assignment.
One fruit or vegetable, something new.
Something new, yes. All right, we'll look forward to that. From the Jackson County Health Department, Director of Personal and Preventative Health, Matthew Budd. Next up, we're going to celebrate some birthdays and anniversaries, the Birthday Club, after this.